One.
Good afternoon and welcome to the Board of Health meeting of May 17th, 2021. Please note that this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, general law, Chapter 30A, Section 18, and the governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Chatham Board of Health is being conducted via remote participation. No in-person attendance of members of the public is permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the phone number, which is 1-508-945-4410, and the conference ID number is 184-922-194#. Despite our best efforts, if we are not able to provide for real-time access, we will post a record of this meeting on the town's website as soon as possible. I will turn the meeting over now to John Beckley.
Thank you, Judy. First thing I'd like to do today is to establish that we have a quorum on the call, Board of Health members. So when I call your name, please indicate whether you're on the call. Dr. Noble Hanson.
Present.
Ron Broman.
Here.
Ed Sheehan.
Here.
Carol Boyce.
Here.
And I'm here. Those are the 5 voting members. And then we have alternate members, Dr. Dick Edwards.
Here.
And Dr. Alan Ward.
Here.
Okay, excellent. Everyone's here. Okay. We've got a short but important agenda today. So let's start with item 1 on the agenda, which is a variance hearing and approval of IA Technology for Andrew and Rachel Fay at 63 Andrew Mitchell Lane, and representing the applicants is Clark Engineering, LLC.
Good afternoon, David Clark.
David Clark, yes, you have the floor, David.
Thank you. For the record, David Clark, from Clark Engineering on behalf of the Fays. The Fays are in the process of developing plans to renovate their dwelling on Andrew Mitchell Lane. The lot is just a hair over 40,000 square feet. Pursuant to your nitrogen loading regulation, they'd be entitled to 4 bedrooms. The current house is 3 bedrooms, and their redevelopment plans include 2 additional bedrooms or rooms that qualify as bedrooms. So they're allowed to have 4 as a matter of right. They can request the additional bedroom pursuant to your regulations if they propose a nitrogen reducing technology. That's what they're proposing. A singular system to remove nitrogen. And as always, a 5-bedroom system with treatment introduces less nitrogen to groundwater than a 4-bedroom system without. There were some questions on the floor plans. I believe they've been modified to satisfy Judy's concerns, but I will let her speak for herself.
Judy?
Yeah, hi. I'm sorry, I don't have the floor plans in front of me, but they did, I marked up the floor plan that you have in front of you, which shows a cased opening in one room. And I think both spots, they cased the openings to make 2 rooms that could have been a bedroom because of privacy issues, not a bedroom. So I was okay with that, and I will make sure when the building plans come in that they will be have the same changes on them.
Yeah, I believe Mark Zebrack also removed the bathroom, the full bathroom too.
Correct, right. That was a big deal too, so.
All right. Board
Judy,
member
it's
questions or
Ed Sheehan.
comments? Go ahead, Ed.
It's
It's a kind of a tight corner there, and I'm wondering if it's large enough to take this new amount of waste.
Well, it's a 1 acre lot, so
Yeah.
there's more than enough room for a 5-bedroom system on this property. We did squeeze it into
but it doesn't seem to be the system itself doesn't look quite big.
It is sized for 5 bedrooms.
Okay.
We put it in that corner of the property because that's where the existing plumbing comes out of the house.
Yeah.
Rather doing a major plumbing change to go out the back where the tennis court is, we decided to keep it where it was because we could fit a 5-bedroom leaching system and a 5-bedroom reserve area in that space. It meets all the setback requirements.
Is the gray area the alternate?
Yeah, there should be a rectangle the same size as the primary leaching that has the letters RA inside it.
Okay. All right. That's my question.
Thank you, Ed. Any other questions or comments from Board of Health members?
Yeah, this is Noble. It goes back to the discussion we had at the last meeting. So into the sewing room, and I think Judy had these enlarged, there's a 4-foot arch entering the sewing room and then a 6-foot arch from the sewing room to the office. But did we decide that a 4-foot arch, Dick brought this up a couple of weeks ago, is a 4-foot arch enough of an opening that it's not easily converted to a door? Did we decide, does Judy feel that the 4-foot arch is satisfactory? I mean, they may have room for a 5-foot arch.
Yeah, I mean, we don't have anything in our regulations that says whether it has to be 4 or 6 or 5. I usually, again, as I said the last time, depending on how much space they have and if they have the ability to widen it out as much as possible. So that could be something that I could look at with the architect and see if we could widen that out to 5 feet at minimum. And then I think in the future, we should probably maybe look at our regulations and maybe be a little bit more specific in them as to how big we want these doorways to be.
Yeah, this is Noble. Yeah, I always have the question, is our board the last decision maker as to whether this is truly a 5-bedroom house or is actually more bedrooms? Are we the last one to review this, or does this get reviewed by the planning board when they get a permit and all that?
They don't, no, I don't think this is going to ZBA. David would know, but they don't really look at. It is?
Yes, it is. I'm in a butter, I'm sorry, but the planning board meeting's the 27th of the month.
Okay, so I haven't reviewed it for them yet, but they don't look at number of bedrooms. They look at lot coverage. So they don't really care how many bedrooms usually. And so really it's the health department is the only ones that look at bedroom number.
Yeah.
I think that the way that's set up, you have to walk through the sewing room to get to the office. So the sewing room can't be a bedroom. And
Correct.
You'd have to consider the entire sewing room office as one gigantic bedroom suite to call that a bedroom.
Yes.
Because you have to walk through the sewing room to get to the office, so there's no privacy in the sewing room. So that can't be a bedroom. And the office can't be a bedroom because the door's too big. So unless you called that entire sewing room office a huge bedroom suite, it wouldn't be a bedroom.
And there's also a Chatham doesn't follow it for the most part, but under Title V, there's a presumption that when the total number of rooms in a dwelling exceeds 9, you take the total number of rooms, divide by 2, and round down and that's the presumed number of bedrooms. So with a 5-bedroom design, this dwelling could have 11 total rooms. And I think we're at 11 or 10, I think, at this point. But yes, the sewing room is, I consider it a pass-through room.
So there's no, yeah, so I would agree if Judy just see if they can enlarge it to 5 feet, that would be good. And then maybe in the future, we can sort of clarify what the guidelines are, because this question comes up time after time.
Do people still sew?
Well, a buddy of mine does cleanouts after estate sales, and from what I see, what he throws away, people don't sew anymore. But
I don't think they do either. Okay, well, any further questions or comments? We do have a memo from Judy to the board members dated 5/12 that recommends approval and then recommends 9 conditions be attached to the approval if we decided to proceed in that way. Maybe can I get a motion to approve from a board member?
Excuse me, does the public have a way to comment on this?
Yes, they
I thought when
do.
I read your letter, well,
Yes.
I'm in the butter. I'd like to make a comment.
Okay, I'm going to ask for public comment before we vote.
Okay, thank you.
You're welcome. Can I get a motion to approve on the floor?
Yeah, this is Noble. I make a motion to approve the variance with Judy reading the conditions, the 9 conditions.
Can I get a second?
Second, Ron Broman.
Second, Ron Broman. Judy, do you want to read those 9 conditions for us, please?
Sure. Number 1, the applicant should restrict this property to a maximum of 5 bedrooms and record this restriction on the deed at the Barnstable County Registry of Deeds. The applicant shall submit a copy of the executed deed restriction to the Health Division. The applicant shall sign a covenant with the board agreeing to comply at such time as the town of Chatham through the Board of Health and/or Water and Sewer Commissioners directs the connection of this property to the municipal sewer when it becomes available. This covenant shall be recorded at the Barnstable County Registry of Deeds, and a copy of the executed covenant shall be submitted to the Board of Health or the Health Division. Throughout its life, the system shall be under an operation and maintenance agreement. An O&M agreement shall be for at least 1 year, may be with any Mass certified operator of the appropriate grade that has received training by the company on the operation of the system. Effluent from the system shall be monitored at least twice per year for the first 2 years, preferably May and October. The effluent shall be field tested in accordance with Mass DEP standard conditions for secondary treatment units certified for general use, revised March 20th, 2015. In addition, a lab test of the effluent for total nitrogen to meet the performance standard of 19 milligrams per liter shall be collected and analyzed by a certified lab. Water meter readings are to be provided with a semi-annual report. If any of the field tests or lab tests fail, follow-up tests shall be conducted by a certified lab and an evaluation made by the operator within 30 days. After required 2 years, testing application can be made to the board or its agent for review and possible modification of the monitoring requirements. The applicant agrees to apply a minimum of 6 inches of compacted topsoil to all disturbed areas of the property. The engineer shall submit an engineered as-built plan, including as-built elevations with a written certification that the system has been installed in accordance with the approved plan. No alteration of the floor plan of the dwelling or the engineer's site plan will be allowed without further review by the board or its agent. This variance is granted pursuant to the state Title 5, in the town of Chatham subsurface sewage regulations, and is valid from 1 year from the date of the Board of Health approval. All permits must be issued and work commenced during that 1 year period, or the variance shall expire.
All right, thank you, Judy. Now, before the Board of Health votes on this motion, we want to open it up for anybody from the public who wishes to comment. The gentleman that was just on a moment ago, can you identify yourself,
Yes,
please?
my name is Jim Muse, that's M-U-S-E. I'm
Okay,
at 27 Kendrick Road.
go
And
ahead.
I'm Okay, I have just a few points. My objection is that we're increasing the nitrogen level. I believe it's the Board of Health's responsibility to enforce the codes that are in place today, instead of issuing variances to a plan that's not going to be achievable down the road. Because if there's a problem, then the general vicinity has a problem. This is a very sensitive area, like many parts of Chatham. I don't know if the board's aware, but off of my property, there's a vernal pool. That vernal pool is registered and is governed by town bylaws, which means that we can't do anything. I think it's within 50 yards of that vernal pool. Now, about 4 years ago, that was disrupted by an abutter. The town stepped in and forced them to reforest it, the entire area down below me. On my driveway alone, I can't pave it because it has to stay water permeable because of the issues that surround the area. Also, I think that someone should walk the area and make sure we understand how other homes were placed in there and the abutting topography of where this leaching field is going to come out and across and down onto my property. So I really object to this, and I think finally we can't pick up the paper in Chatham or listen to anything in Chatham lately that doesn't have something to do with nitrogen loading, erosion, pollution of the aquifer, 9,000 different things that could go wrong here. And yet, from an optics point of view, we look like we're going to approve to put a system in that would allow more nitrogen loading. It just doesn't appear right. We say one thing from town elected and other officials within the town, and here we are talking about adding or allowing more nitrogen into the subsoil. So I guess I just would push back and say I don't believe that this is the right plan in the area where it's trying to be placed. Whatever should be done and whatever the right of the owner is, they have those rights, they should do those. But to push more into the ground does not seem to be what Chatham seems to represent itself as going forward here with all the provisions that it puts in and regulations and holding people to perform those regulations. I would further ask, if this system is so good to control the nitrogen level, then why isn't it imposed on every new home or every new system going into Chatham? Because it would seem to be a very simple way at some cost to reduce the nitrogen loading going into the ground. That's all for me. I would push back, and this does go before the Zoning Board of Appeals on the 27th. I have a registered letter here from David Nixon on this, as well as the one I received from you folks. So if there's something else in here that the Board of Health doesn't realize, maybe they need to get with the Zoning Board of Appeals to find out what else is going on here.
Thank you. Thank you, Mr. Muse.
Okay. Thank you very much for listening. I really appreciate it very, very much.
You're welcome.
And I'm sorry I didn't get anything to you earlier. I just actually drove in from Florida.
All right. I think I'd like to hear some comments from Judy on some of the issues he's raised, and David Clark as well, the design engineer.
Well, so they, by right, which we don't, we use that term, but because it's over an acre or 40,000 square foot plus property, they are allowed to have 4 bedrooms there. And with a nitrogen loading removal system, which is what they're proposing, they will actually create less nitrogen on the property with a 5-bedroom system than they would with a conventional 4-bedroom dwelling and conventional 4-bedroom septic system. So, it really is a win-win for the board, I think, because you're getting nitrogen removal well beyond what you would get with a conventional septic system. And we don't require them on every system if they can meet the 1 bedroom per 10,000 square feet of lot area, which is what our nitrogen loading regulations say. And ZBA will be looking at lot coverage and building height and things like that, which we don't look at. I'm not sure about the vernal pool. David can tell us how far away that is from the property.
Thank you, Judy. Let's see if my mic is still on. So thank you, Judy. Yeah, we are aware there's a vernal pool on the abutting property. The septic system is more than 250 feet away from that vernal pool. And because this is a system that's been designed to conform with Title V, there is absolutely no worry or concerns about effluent from the septic system getting down to that vernal pool. As most of you are aware, when Title V changed in 1995, the size of these leaching fields basically tripled. And you rarely see a 1995 code Title V system fail for hydraulic reasons. So I have no concerns about the proximity, or actually it's not really proximate to this septic system of that vernal pool. And regarding the nitrogen loading, I think Judy summed it up perfectly, that the 5-bedroom system with treatment introduces less nitrogen than a 4-bedroom system without. And again, they're allowed by right to have a 4-bedroom system on this property. One other additional benefit that pertains to nitrogen, but it's not really addressed in your regulations. They're removing the tennis court, and atmospheric deposition plays a small part in nitrogen loading, and that tennis court is coming out, so there will be an additional reduction in nitrogen by the removal of that tennis court. As far as zoning board of appeals, the only reason why we're going to zoning board of appeals is that one corner of this house is less than 25 feet from the property line. I believe it's 24.7 or something like that. And that is the only nonconformity about this project, and it's an existing nonconformity. Everything else that's being proposed conforms with the zoning bylaw. And again, that'll all be addressed at the zoning board of appeals meeting.
Mr. Muse, do you find that somewhat reassuring, what you just heard?
Not really, because if the system was as good as we say it, or it's being said it is, then I would suspect that the town of Chatham, with all the issues it has surrounding nitrogen loading, this would be employed already as a measure to go with 3, 4, 5, or 6-bedroom homes. It wouldn't matter. You would use it to lower the nitrogen build. And the fact of the matter is, I understand by right that they can have 4, and that's fine. Maybe they should have 4 with the new nitrogen system in it and further reduce it. I just have an issue. My issue is that the town continually talks about nitrogen loading. You can't look at the paper any time during the week and not see something in it. And I can't understand why we would be entertaining a change in the code regulations that would allow more nitrogen loading.
If we were, just to rebut that, if we were proposing more nitrogen entering the environment, the board would not approve this application. So I think it's well documented that nitrogen removing technology works. I think the Board of Health years ago did not adopt a policy to require all upgrades to include nitrogen removing technology because of the extreme cost. With 7,000 residential units in the town of Chatham at $10,000 apiece for the additional nitrogen removal, that's $70 million that could go towards our wastewater treatment facility.
Right.
And I think that's the direction Chatham chose to go. You get more bang for the buck, sending that money into a comprehensive wastewater system. You get better treatment through the municipal system, and you remove the wastewater from the proximity to all our embayment. So, anyways.
Okay, I've
That-
got it. Thank you very much. I appreciate
Yeah,
everyone's
this is
time.
Richard
Understood.
Edwards. Can you, it appears to me that the concern is that you're going from 3 bedrooms to 5 bedrooms.
No,
And-
that's not my concern.
Well,
My
no,
concern is,
and let me finish, please. And that the total amount of nitrogen going in with the alternative system in 5 bedrooms is more than what's currently going in with 3 bedrooms. So how much more nitrogen is going into a system with a 5-bedroom house with an alternative system than with a traditional 3-bedroom house with a Title V? I know that with the alternative treatment system, a 5-bedroom makes less than a 4-bedroom, but how much more does it make than a 3-bedroom, which is what's there now?
I can't answer that off the top of my head. I don't know if David can. I haven't run the numbers.
Now, we didn't
We're not
consider
really reducing the amount of nitrogen. We're keeping the amount of nitrogen within the requirement of the code.
Correct. Yes.
Well, I'd like to move ahead on this because we have other things we have to address, but
John, I think Bob Duncanson's hand is up.
okay, I didn't see that. Go ahead, Bob.
Yeah, John, I was just gonna, in general, address the gentleman's concern about, nitrogen. As David rightly pointed out, we've completed our comprehensive wastewater management plan back in 2009. We've been working on implementation of that since 2010. And we did evaluate, one of the options we evaluated during the CWMP process was whether or not requiring innovative alternative septic systems on every property in Chatham would get us where we need to get in terms of the, mitigating the negative impact in the estuaries. And the upshot of that was the answer is no. That the current technology back in 2009 and even the current technology today of innovative alternative on-site septic systems is not as good as a municipal septic treatment facility or a sewage treatment facility. And so after evaluating the option of innovative alternative septic systems on, as David said, roughly 7,000 properties, we discounted that because it doesn't get the community where we need to get to. So I think the important thing to keep in mind here is that, yes, the nitrogen load from this particular property will be less at 5 bedrooms with an innovative alternative septic system versus a 4-bedroom septic system without any treatment. But ultimately, this property, as all the properties in Chatham, will be connected to the municipal sewer system, which would then remove that nitrogen load from the septic system in its entirety. And so this is really, for want of a better term, a stopgap until the municipal sewer system is expanded throughout the community. But it does get the board where the board wants to get to, which is during that interim period, reduce the nitrogen load coming off that property from the septic system.
All right, thank you, Bob. I'd like to go ahead and call the question on this motion. So when I call your name, please indicate how you vote. Dr. Noble Hanson,
Approve?
Ron Broman,
Approve.
Ed Sheehan,
No.
Carol Boyce,
Approve.
and I vote to approve. So the motion carries. The variance hearing is granted. Okay. Thank you, everyone. Let's go
Thank
on to
you.
item
Thank you.
2 on the agenda, which is a follow-up discussion on the nuisance code relating to the John McGrath property at 32 Mill Hill Road. I know this is an issue, a longstanding issue that the Board of Health has been involved with, and perhaps somebody can summarize where our most recent contact was. I believe that we issued a notice, Judy, in November.
Yes, the last, we issued a nuisance order in November of 2020, and with no answer from the owner, Mr. McGrath, or any really change in the situation. If anything, it's worse than ever over there. So that's where we're at, and then there's been lots of discussion with, again, when we issued that order, they were also issued orders from the fire department and the building department as well. So we hit them with 3 different orders, but ours was the nuisance order, and ours at this point probably has the most weight moving forward for getting the property cleaned up.
So I know the Board of Health is committed to staying on this issue and bringing about a remediation of some sort. And I hope everybody has personally gone down and walked that street and inspected the conditions. I went today and I actually paced off from one side of the frontage of the property to the other side, and I got about 400 feet long. And my estimate is the debris goes back maybe 50 feet, 25 feet from the road. So there are thousands and thousands of square foot of illegal dumping and accumulation of waste and whatnot on that property that needs to be addressed. I know we've been talking about this recently, and I think we need to proceed with a final notice to the property owner outlining the board's intent to take action. Perhaps we should invite Mr. McGrath to the Board of Health for a hearing to have one last opportunity to discuss with him what our expectations are and give him an opportunity to be heard, but perhaps even outline at that point what we're prepared to proceed with in terms of the self-help remedy. What do other board members think about that at this point?
Ron Broman, I think it would be smart to invite him to come back in front of our board for once. I mean, he probably won't show up, but at least we'll show that we intended to get him in and try to straighten this out before we have to do anything else.
Anybody else?
Is this Noble? Yeah, I agree with asking him back one more time and making a final order to clean up. With how many days? Would it be 21 days like the last one in November? I would ask that. And then, but it's time to proceed. And I guess what would be the next step after the order that if he doesn't comply in 21 days? I'd ask Judy or Dr. Duncanson that question.
We could, they may, let's see if Judy or Bob knows. Otherwise, we would contact the town attorney and get direction from him.
Okay.
But I know there would be another a final legal step and notification thereafter.
Right. So I agree with a final order to clean up and an order to appear before the board.
Okay.
And then proceed from there to get it cleaned up.
Is that a motion?
I can make it a motion, yes.
Can you make it a motion, please?
I make a motion that we order a final order to clean up the property as a nuisance, and that we order Mr. McGrath to appear before the Board of Health to give him one last chance, and then proceed on with cleaning up the property after that if we don't get satisfied.
Okay, can I get a second to that?
Second, Ron Broman.
Second, Ron. Okay, any other comments from board members before we vote on that motion?
Well, Ed Sheehan,
Yes, Ed?
we've gone through this 2 or 3 times now in my estimation, and he just doesn't work. You know, he promises and he does nothing.
Understood. Understood. Any other board member want to comment before I offer? Anybody from the public want to comment on this before the Board of Health votes? Okay. Okay, we ready? Let's vote on the motion. When I call your name, please indicate how you vote. Dr. Noble Hanson.
I vote to approve.
Ron Broman.
Approve.
Ed Sheehan.
Approve.
Carol Boyce.
Approve.
And I vote to approve. So we have 5 votes to approve. So that will proceed as accordingly. Item number 3 and 4, I'd like to, as the chair, I'd like to request that we flip those so that we get the benefit of the latest COVID-19 update from Dr. Duncanson before we take up the question of the disposition of the county of the current mask order. So Bob, can I ask you for a COVID-19 update to get us current with what the trends are right now?
Yeah, sure. Thank you, John. So here's the latest COVID-19 numbers. As of this afternoon, we currently have 323 cases since the beginning of the pandemic, going back to January 1st of 2020. We've had 3 cases so far in May of this year. And let me share my screen and I'll show you the most updated graphic. Can everybody see the graphic of the monthly caseload?
Yes.
Okay, so this is our case, basically our caseloads each month since the pandemic began, and really in March of 2020. And you can see that we're very low this year in May of 2021 as we were in May of last year, coming off the peak that we had back in, started in mid-December at least, right after the Thanksgiving holiday, and then into January, February, we had that slight peak in March of this year again when we had the outbreak in the Mid-Cape area related to some of the variants. But as of today, we've had 3 cases so far this month. We currently have 1 active case, meaning we just had a case reported on Friday. So that's the only one that we currently have active. All the other positive cases this month have already exceeded their 10-day period, if you will, for which we carry them as active cases. And so things are, things have been trending down, and they continue to look very good. In terms of some of the other statistics, what I'm showing you right now, this is the previous 2 weeks statewide number of cases and the split in the age demographics. So in the far left column, you have the age demographics. You then have in the middle column, you have the number of individual cases within each one of those age demographics. And then in the far right column, you have the percentages. And just the reason why, we've been showing this recently as opposed to the age distribution of Chatham specific cases is, as we've talked about for the last couple of months, there has been a substantial shift to the younger demographic. When this thing began and through last summer and early fall, most of the cases we were seeing were basically in the 60 and older age demographics. We're now seeing very few cases in those age demographics, and we are seeing a substantial shift to the 20 to 39-year-old age demographic. Those are the two demographics that have been the primary ones for the last couple of weeks. We're also seeing, you know, not a huge jump in the younger demographics, but, you know, as you can see, the 15 to 19-year-olds account for about 12% of the cases statewide. And even some of the younger demographics, the 0 to 4 and the 5 to 9s, you know, are greater than 5% of the cases, which is comparable to the 60 to 69-year-olds, where the, you know, the older demographics, 70 and above, have dropped off to, you know, around less than 2% or 1%. And then in terms of some more Chatham specific data, this is our 14-day average daily incident rate, which is another kind of indicator of where we are. For the last 4 weeks, Chatham has been in the gray zone, which is the lowest of the state's categories, red being the highest and gray being the lowest. Our 14-day positivity rate as of last Thursday, keep in mind this data only comes out once a week. We were at 1.71%, which was up a little bit from the previous week, which was at 1.4. Barnstable County as of last week was at 2.3%, which was down from the previous week. And the statewide average was at 1.48%. The statewide 7-day positivity, which is a more accurate depiction of, you know, the really recent time period as opposed to the 14-day, the statewide average was at 1.15%. And as of earlier today, it was down just about at 1%. It had dropped even a little bit in the last couple of days. And our 14-day average daily incident rate was at 4.9%, which was the same as it had been the previous week. So again, all indicators that things are improving both in Chatham, in Barnstable County, and statewide. And then the final graphic that I'll show is just our vaccine percentages, and as shown previously, we basically show you 2 weeks here. So the bottom graph is the older, based on May 4th. The upper graph is as the most recent data as of May 11th. And keep in mind that is the most recent data on May 11th. These reports come out every Thursday, but they're always data as of the previous Tuesday. So this data is almost a week old yet, but we won't have any new data until Thursday. And again, just, you know, what's important here is that the vaccination rates among Chatham residents continue to go up. And we see two things. We see overall vaccine rates continue to go up, as well as we see a larger proportion of those individuals now falling into the fully vaccinated as opposed to partially vaccinated category. So again, all good indicators that things continue to improve, people continue to get vaccinated, and, you know, we expect that to continue over the next couple of weeks as well. So I will stop sharing my screen and we'll get back to in person here. So let me take any questions regarding any of those graphics. And then I do have obviously some new updates because the governor did make some announcements this morning that we just want to make sure everybody's aware of. So Mr. Edwards, I see you have your hand up.
Yes. Can you give us any more information about the more recent cases in Chatham? For example, are all of these unvaccinated individuals? And do we have any data on how they may have acquired their infection?
The short answer to both of those questions is no. We don't get when the information that's available to us at this point does not indicate whether or not somebody has been vaccinated. Given the fact that there have only been about 5,800 cases nationwide, of individuals that have received vaccines that are then testing positive, so-called breakthroughs. I would suspect that none of our cases locally, fit into the category, but there's no way to tell because we don't get that kind of definitive information. And then, in terms of any other information about the cases and specifically where they may have gotten it, sometimes that information is available. I can tell you that in the most recent case, based on the information that's available in the state's tracking database, if you will, they don't know where they may have gotten it. I can tell you that in that case, there was a close family member who had it previously, whether or not they got it from them or they got it from some other source. There's just unfortunately no easy way to tell. Sometimes when there's a large number in a particular household all at the same address, then you can pretty well speak to household transmission. But in this case, because of the timing involved, the first case was several weeks ago. Now the second case, whether or not it's absolutely related, to the family member who was positive previously, there's just really no way to tell. They could have gotten it somewhere else when they're out and about. So,
All
all
right,
right. If there's no other questions from members of the board, then I'll give you guys an update, not only the board, but also the members of the public that are listening in. So this morning at 11 o'clock, Governor Baker announced that effective May 29th, so the Saturday of Memorial Day weekend, basically all the changes, all the restrictions, all the limitations in Massachusetts will disappear. And basically, as of May 29th, all industries, and by industries, we're not talking about heavy industry, but things like restaurants and retail and gyms and everything else, they will be able to reopen without any limitations, as well as the gathering limits that affect the number of people that can gather in public places or event venues or in private homes and whatnot will also be rescinded. Effective on May 29th, the face covering order will disappear and it will be replaced by a face covering advisory, which will be in line with the latest recommendations from the CDC. So the current face covering order that took effect a couple of weeks ago, that remains in effect until May 29th. At that point, then it will be removed and replaced with an advisory that will be consistent with the latest update from the CDC. There will still be a requirement under that for certain areas where face coverings will be required. They will be required for all individuals on public and private transportation. And that really is consistent with the TSA's requirement at the national level. But folks will need to continue to wear face coverings in ride shares, delivery services, taxis, ferries, the MBTA, commuter rail, as well as in the transportation hubs. So train stations, bus stations, and others, you will continue to wear a face covering under those circumstances. As well as face coverings will still be required in healthcare facilities and at providers. So if you go to the hospital or you go to your doctor's office or a clinic, you will continue to need a face covering in those circumstances. You will also need to continue to wear face covering in congregate care settings and health and rehabilitative daycare setting, rehabilitative day services. In addition, face coverings will be required indoors for staff and students in K through 12 schools and in early education providers like daycare settings. Face coverings will still be required indoors. They will no longer be required in outdoor settings. There was also some changes coming up, some taking effect tomorrow for youth and amateur sports, where face coverings will no longer be required when they're playing in outdoor settings. And then effective May 29th, all limitations on sports, youth and amateur sports will be lifted. There's also some updates which just came out later this afternoon on summer camps. So, and we've sent that out to our town programs, as well as we don't really have any summer camps, resident camps in Chatham, but we do have summer camp with our Department of Park and Recreation. So they have been made aware of all the latest guidance for that. And then the other big news that the governor announced today is that effective June 15th, the state of emergency in Massachusetts will be lifted. And so we're waiting to hear what impact that may have on things like having to meet virtually and whatnot. I know there are some efforts underway at the state legislature. There are some things like virtual meetings that, some cities and towns have indicated are helpful. And they would like to be able to continue to do that. And so I know there is some effort underway in the state legislature to pass some, potentially pass some legislation. And that is one of the reasons why some of these changes are not taking effect until May 29th, was to give the governor and the legislature time to work on some of those items and potentially pass the legislation that would keep some of these things in play once the emergency order or the governor's state of emergency is lifted. So with that, I'm happy to answer questions from the board. And then I know there's probably a lot of interest in the public about some of these things and how they might impact the board's order regarding masks in certain areas of Chatham. So
Noble,
back to you, John.
Noble has his hand up.
Yeah, this is Noble. Before we get into the mask order downtown, just to get specific, are all the restrictions on a possible parade being lifted as of May 29th or June 15th? Because the issue will come up for the 4th of July Chatham parade. It's already been canceled, but it'll be an issue. I know we have I'm not speaking for the parade committee, but we have a parade committee meeting this Friday, and that the issue will probably be raised.
Yes, the answer to your question is yes. Effective May 29th, all those limitations on things like parade and outdoor gatherings and all will disappear. Yes. And I know that that was going to be a topic of interest relative to the parade. As you know, you folks made a recommendation to the Board of Selectmen that it be canceled. The parade committee as well made a recommendation to the Board of Selectmen the select board that it be canceled. And the board subsequently did vote to cancel the July 4th parade. I did have a conversation this afternoon in anticipation of that being a topic of discussion here tonight with the police chief. And he's, as you're well aware, he's the liaison to the parade committee. And Noble, I know you're on the parade committee. And, the discussion we had was that given the short time period between now and July 4th, that it would be logistically difficult to try and hold the parade, on July 4th, just given the fact that we're already in mid-May. But as he pointed out, and, you folks recommended in your recommendation or stated in your recommendation to the Board of Selectmen that the parade committee may consider a summer parade, maybe in August, given the fact that originally all these limitations were supposed to be lifted around the 1st of August. So I'm sure that will be a topic of the parade committee Friday night. And then hopefully, you guys will be able to maybe provide some more input to the Board of Selectmen regarding a parade sometime this summer.
Yeah, and the chief is our liaison, so he'll be at that meeting Friday, and he
Yep.
can talk directly to the issue.
Right. Yep.
Any other questions from Board of Health members for Bob at this point? Any members from the public wish to ask Bob any questions about his report? All right, let's move on. Let's go to our agenda item number 3 that we skipped over, which is a discussion about and a vote on the mask order update. Well, certainly we've had a lot of changes in the world in the last week. And most importantly, the surprise announcement from the CDC, which I think everyone would consider good news. And they had a variety of reasons why they went with their new policy as they did, which included the trending downward of the COVID cases and the deaths, and the trending up of vaccinations, and the remarkable performance that the vaccines have been showing in not only protecting recipients, but also suppressing transmission. And there was also information released fairly recently about the outdoor transmission being very low. So I think we, as the Board of Health of Chatham, we currently have an emergency mask order in place that mandates strict wearing of masks in 5 locations in town. And we need to decide what to do about that. I, for one, think it's probably time to repeal it in light of what's going on nationally and at the state level. But I think we need to have some discussion as board members about that, or consider any other alternatives. So let me put it out there to see what everybody's thinking about our next steps.
Hi, this is Dick Edwards. The CDC reported that it has new data that demonstrates not only that vaccinated people don't get symptomatic disease, but they also have an extraordinarily low risk of developing asymptomatic disease and transmitting it, which is different than what was said before. So what they've basically said is that vaccinated people are essentially bulletproof. And the risk then is to the unvaccinated people, and particularly unvaccinated people who don't wear masks. So, my thinking about this is that we really don't need a mandate that everybody on Main Street and the Fish Pier needs to wear a mask any longer. But following the CDC's guidance, it would probably be good for us to have an advisory that in Chatham, all unvaccinated individuals should wear a mask in places where they can't socially distance, such as Main Street, the Fish Pier, and the Overlook, but with no enforcement and no fines. And the same thing would be true for people going into restaurants and bars. If you go into a restaurant or a bar and you're vaccinated, there's no reason to wear a mask. If you're unvaccinated, then you could contract COVID and you could transmit it to other unvaccinated, unmasked individuals. But that's on them. I don't think that the town has the absolute responsibility to protect people against themselves for making bad personal decisions. So as long as the staff in the stores and the restaurants and the bars are vaccinated, there really isn't a reason for them to have to wear masks either. So I think the best bet for us would be to have an advisory and maybe have a sign that says, in Chatham, the Board of Health advises that all unvaccinated individuals wear a mask when they can't adequately socially distance, including Main Street and the other places. And, we should be able to have a parade. We should be able to have baseball games. We should be able to have band concerts. And, I'm sure a high proportion of unvaccinated people are not going to wear masks, but the risk is on them. And they're not going to infect vaccinated people. They're taking their own personal risk by not wearing a mask.
Thank you, Dick. Other Board of Health members wish to comment.
Ron Broman, the only place that I have questions on is downtown, how crowded the people are going to be and everything. That's the only one I'm iffy on. The rest of them, I think it's time to go. I go up to the transfer station and no one's wearing them except for me. And, it's probably time to do away with them up there. But downtown is the only place that really I still have some concerns for.
Yeah, but Ron, the science has been concluding that outdoor transmission is almost non-existent. I mean, it's not zero, but what I've been reading is that it's exceedingly rare that there be outdoor transmission, and far below even what the CDC originally or recently put out there is up to 10%. But remember, even during the pandemic last summer, the cases went way down during the summer months, even then. And I think with this buildup of vaccination, what I read, 70% of Massachusetts residents, adults, have had at least one dose of vaccine. That's wonderful.
75%.
75%. I mean, that's wonderful. So, Bob, let me ask you a question. The recommendation that Dick made that we post signage urging unvaccinated residents and visitors to wear masks if they cannot socially distance, and when they go indoors, would that track then with what the state guidelines are going to be at the same time? Would that track with that?
Yes, that would track. Yes, because the state is going to follow the CDC guidance. So yes, that would track with what CDC is saying. I think one thing to just keep in mind before everybody kind of runs out and rips their masks off, Massachusetts doesn't change until May 29th. Right. So just because the governor announced it today, I don't want people to think, and we've posted information on the website and all, that this change doesn't take effect until May 29th. So we still have, basically 2 weeks to go before this kicks into place. Until then, the Massachusetts mask order, requiring masks outdoors when you can't socially distance, requiring masks indoors in, retail shops and restaurants and those kind of places, that still is in effect. But
and
on the 29th, we could be consistent. Yes.
But if the Chatham Board of Health tonight repeals our emergency mask order,
yep,
that would then mean that as of tomorrow or the next day, whenever our order takes effect or whatever our decision takes effect, then downtown Chatham becomes subject to the existing state guidelines from now through the 29th of May.
Yes, that's correct.
Okay.
Can't we make it effective May 29th? And I'd also be careful about the outdoor transmission data. Remember that people wear masks outdoors, and there was an inauguration ceremony in the Rose Garden of the White House for Coney Barrett, and about 20 people got COVID at that. So I think a lot of the stuff you see on the internet and everything about there's never been a case of COVID transmitted outdoors is not accurate.
I agree.
Yeah, the critical thing that CDC has said is vaccinated versus unvaccinated people. If you're vaccinated, as Dick described at the beginning, that is the game changer here. Not necessarily wearing a mask or not wearing one. it's vaccinated versus non-vaccinated people.
Okay. Well, what do other board
Wouldn't-
members think about the timing of all this? Noble?
Yeah, there's no, yeah, I think, I mean, I agree with what's been said, because of the CDC changes last Thursday and the governor's changes May 29th, and then June 15th, no more state of emergency. I agree with rescinding our previous mask order, and then we had a new mask order up for a vote with some changes, and I would say table that. And then I would say we would move to, as Dick said, an advisory that if you're unvaccinated in downtown Chatham, you need to wear a mask if you can't social distance. And then that just dovetails with, as I understand it, what the Massachusetts orders will be. To me, I'm just thinking we might as well just make it effective right now because I just don't see the difference.
All right. I would, this is John. I tend to agree that there's no reason to wait because the state guidelines will still cover the town until the 29th.
Correct. And the CDC guidance, I mean, everybody has heard it. I mean, everybody has heard it and they, it has changed behavior already, I think.
Any other Board of Health members want to comment on this? Can I get a motion to repeal the existing mask mandate?
Ed Sheehan, approve.
Do I get a second?
Carol,
Carolyn,
second.
second. Before we vote, I want to ask or invite anybody from the public who wishes to comment on this.
And do we want to put the date of repeal as of today? Correct.
Effective immediately, yeah, I would say that. Elaine Gibbs's hand is up. Elaine?
Yes, thank you. I agree with this motion. I did have one question for Bob. I don't know if I misunderstood. So one of the reasons for the May 29th date was that the legislature and Baker are considering exempting government from this. In other words, that it would stay in place and we'd continue to do Zoom meetings until further notice. And I was wondering what the rationale is for that, if I understood correctly.
Yeah, no, you're partially correct. They held off doing anything until the 29th for really two reasons. One was to give businesses and others a 2-week period to kind of adjust and, rather than just saying, oh, everything takes effect tomorrow, and business is trying to scramble, what do we do? They're giving basically everybody 2 weeks notice. Hey, these are the changes. This is when they're coming into effect. Now, one thing to keep in mind is private businesses can continue to do whatever they want in their business. So you may still have stores, that would require people to wear a mask come, the day after May 29th. Or you may have restaurants that require masks or still continue to do, 6 feet between tables and all those kinds of things. Individual private businesses continue to do whatever they feel is appropriate. But the other reason why they put it off for the 2 weeks basically was there may be some interest in the legislature to do some things with things like the open meeting law that they did the emergency order on to allow virtual meetings to take place. Some communities throughout the Commonwealth have indicated that virtual meetings have worked out very well for them. They've seen increased public participation through the virtual meeting process. And so there's been some interest in, potentially amending the open meeting law to allow that as an option if a community wanted to do it going forward. Doesn't require communities to do it, but it at least would give them the option to continue some of the things like virtual meetings if they choose to do so once the emergency declaration has been rescinded. Because technically, once the emergency declaration has been rescinded, all those kind of special things that were put in place in response would disappear. And so the administration and the legislature have heard that some of those things are beneficial. So they just wanted to give themselves some time to potentially pass some legislation that would allow some of those things to stay in place.
Can we see at some point over the next few weeks that the town offices will start to open up so people can go in and do transactions?
We will be reviewing that probably tomorrow at our department head meeting as to, yes, that I suspect there will be changes coming, yes.
Okay, thank you very much.
All right, let's go ahead and vote on the motion that's on the floor, which is to repeal the current mask mandate effective immediately. And was there something else, Noble, we wanted to include in that
Well, I
motion?
don't know if we have to include that. The other one was a possible vote on a new mandate. We can just table that, and I don't guess it
Yeah,
doesn't need to be mentioned.
We will just choose not to take action on that because it's redundant at this point. Okay, when I call,
We're not going to have an advisory regarding unvaccinated people wearing masks.
If they can't social distance, that would dovetail with the governor's.
I would think that would be a good thing to do.
Yeah, no, just to clarify, based on what I'm hearing, as part of your agenda tonight, we had provided you with an updated Board of Health order that took into account the latest changes coming from the governor. This was before today. It was put together last week.
yes,
That basically just referenced the latest mask order number 67. And I think what I'm hearing tonight is you're rescinding the current order that you put in place last year. You are not going to adopt a new order with the new changes, but you would like us to put together an advisory for unvaccinated individuals.
that's consistent with the state
Right.
guidelines.
Yeah, so that's what I was hearing.
Which means if you need to wear a mask if you can't socially distance, but not mandating that they wear a mask downtown. That's going too far.
Right.
Right. We
I
were
just-
the notes that I had from what Dick said at the beginning was an advisory that all unvaccinated individuals should wear a mask when they can't socially distance.
Yes.
And that would be basically anywhere in Chatham.
Yeah.
Yeah.
And there would be no enforcement provision.
No
on it.
enforcement
That's just
and
an
no
advice.
fine schedule. It'd be
Just
purely
to
an advisory.
So for their own well-being, this is what they should do. And no
Right.
one else can come back to us and say, well, you never said that it was dangerous to be in a crowd at the band concert without wearing a mask. You know, I think it protects us, it protects the town, it protects the people.
Yeah, we'll draft something up and circulate it to the board before we put it out.
Okay.
And I can simply, after I get any feedback, I can issue it as a press release, basically, as the incident commander for the town's response here. And that
Okay.
way we won't have to get the board necessarily back together again.
Okay, that's good. All right, I guess we're ready to vote on this. We have the motion with the,
John?
yes,
Yeah, I see Elaine Gibbs, your hand is still up. I don't know if that's a new comment or just a carryover.
It's a carryover. Sorry.
Okay.
all right. So we have the motion to repeal the existing mask order issued by the Board of Health months ago and to make it effective immediately and to include advisory information in the town, using the town, what do you call them?
Message boards?
The town message boards that we previously discussed, and Bob is going to check to make sure that they're consistent with the state guidelines. Okay, let's go ahead and vote. When I call your name, please indicate how you vote on the motion. Dr. Noble Hanson,
Approve.
Ron Broman,
Approve.
Ed Sheehan,
Approve.
Carol Boyce,
Approve.
And I approve. So the motion carries. Now, does the board wish to take up at this point what action, if anything, we wish to take regarding the parade recommendation? I know Bob gave some information before, and Noble, you have a perspective here. Do we want to withdraw our recommendation to cancel and not say anything beyond that? Or do we want to recommend that the parade in some shape or form proceed? What do people want to do?
Yeah, this is Noble. Yeah, I mean, I think I need to hear what the police chief has to say, because his job is key, and what he says carries a lot of weight. So I think before I did anything, I think I would have to hear from him.
His perspectives will be based on logistics and planning.
Right, but he's the one responsible for traffic, parking, police, crowds. You know, he's responsible for all that. So
I guess my question is, does the Board of Health want to weigh in? And I'm not saying we need to, because we could just wait a while. But does the board feel the need to weigh in on the scientific or the public health aspects of whether or not the parade still needs to be canceled or not? Or we can just wait. I mean, this is not an urgent matter that I see, but maybe we need to do something. I'm open to this. I don't know what others think.
I mean, I guess we could, this is Noble, we could sort of restate what Bob has already stated, and that is as of July 4th, when the live parade would normally take place, there will be no restrictions from the state. I believe I'm stating that right.
No public health restrictions.
Public health restrictions, yeah, and then just leave it at that, and then let it sort of carry forward.
I think the same Board of Health advisory that we just advised, put forth, applies to the parade. So I don't really see why the Board of Health has to do anything different. I mean, the people attending the parade who are not vaccinated should wear a mask. That's the advisory, but we're not going to enforce it. We're not going to check for vaccine status.
No.
So I think our advisory holds for the parade.
But we have a recommendation in place right now recommending the parade be canceled.
I don't think we need to do that. I think we can do away with that recommendation now, given this information.
That's what I'm wondering, whether we should rescind that recommendation.
I would rescind the recommendation.
Do you? At least that would signal the Board of Selectmen and the parade committee that the Board of Health, given the rapid changes recently, the Board of Health's public health-based concerns for the parade have been greatly lessened, if not eliminated.
Right.
And whether or not it makes sense to continue the parade for other reasons is beyond the scope of us, of our area of concern, but that we wished to at least rescind our public health-based recommendation to cancel.
I think you should make a motion for that, to rescind it.
Okay.
I mean, I think that's another way of reaffirming what Bob has already said. So I think it's amounts to the same, basically.
Okay, does somebody care to make a motion?
I'll make a motion to rescind the order from the Board of Health regarding
The recommendation.
the recommendation from the Board of Health regarding the 4th of July parade.
Based upon recent public health.
Upon the restrictions being lifted, and that we will not be in a state of emergency come July.
Okay. Board members okay with that, that motion? All right, can I get a second?
This is Noble. I'll second it.
Okay. All right, anybody from the public wish to comment before the Board of Health votes on the motion? Okay, when I call your name, please indicate how you vote. Dr. Noble Hanson,
Approve.
Ron Broman,
Approve.
Ed Sheehan,
No,
Carol Boyce,
Approve.
and John Beckley, I approve. Okay. We have two sets of meeting minutes we need to approve. And they relate to May 3rd, 2021 and May 6th, 2021. Let's take May 3rd first. Does anyone have any edits or questions or clarifications to make on the May 3rd meeting minutes? Hearing none, can I get a motion to approve?
motion to approve.
Can I get a
Ed Sheehan.
second? Can I get a second? Thanks, Ed. Can I get a second? Okay, thanks,
Second,
Ron. Okay, when I call your name, please indicate how you vote on the acceptance of the May 3rd meeting minutes. Dr. Noble Hanson,
Approve.
Ron Broman,
Approve.
Ed Sheehan,
Approve.
Carol Boyce,
Approve.
and I vote to approve, John Beckley. Can I get a motion to accept the minutes for May 6th Board of Health meeting? That was executive committee meeting.
Motion
Mo-
to
motion to-
approve,
no,
Ed
motion-
Sheehan.
Yeah,
Okay, we have
second,
a
Noble.
motion. Okay, a motion from Ed, a second from Noble. When I call your name, please indicate how you vote on the motion to accept the May 6th meeting minutes. Dr. Noble Hanson,
Approve.
Ron Broman,
Approve.
Ed Sheehan,
Approve.
Carol Boyce,
Approve.
and I vote to approve. Okay, that's the last of the work we have to do. Unless somebody has a last minute issue they want to raise, I think we should adjourn. Can I get a motion to adjourn?
Motion to adjourn, Ed Sheehan.
Thank you, Ed. Second,
Noble, second.
Noble, second. Okay, when I call your name, please indicate how you vote on the motion to adjourn. Dr. Noble Hanson,
Approve.
Ron Broman,
Approve.
Ed Sheehan,
Approve.
Carol Boyce,
Approve.
and I vote to approve. So the meeting is adjourned. Thank you, everyone, for your support.